The phone rang. It was my sister Laura. Recently, we had been talking more regularly. My parents divorced 10 years previously, and this fractured the family and the relationships between my sisters and I. In our late teens and early 20s, out of my two sisters and me, Laura was the one who experimented the most with drugs and alcohol. And I just assumed it was something she would grow out of. Laura is 13 months younger than me, and I was making different choices for my future. Surely she would too. And until she did, I would subconsciously keep my distance. Just when things seemed at their lowest, they got worse. Alcoholism, drug addiction, mental health diagnosis, tumultuous romantic relationships, suicide attempts. The day the phone rang, I realized that this was not a phase that Laura would grow out of. She told me, "Shannon, I tried to hang myself last night in my backyard. I'm at work, but I'm not exactly sure how I got here, and I don't even know what I'm doing." She was sobbing. I found my way from Toronto to Kitchener, where she was at the time, and we met at her apartment. I walked in and thought, maybe if I help her get her apartment cleaned up and draw her a bath, it would make her feel better. It would certainly make me feel better. The place was a disaster. We started in the bathroom. She held the garbage bag, and I started opening the drawers, putting what was clearly garbage into the bag. She looked at me dumbfounded and asked me, "How do you know how to do that?" "How do I know how to do what?" I asked. "Throw things out like that," she responded. I turned towards her. I realized in that moment the situation was beyond me. I was naive to think that a clean apartment and a bath would fix this. I was naive to think that I could fix this. I started opening her cupboards. They were alarmingly disorganized. It was clear that she had been barely functioning for some time. How had we let it get this far? The next morning, we went to the hospital as per Laura's doctor's advice. We spent 16 hours in emergency department waiting. Not the most pleasant 16 hours of my life. Laura tried to leave countless times. She was paranoid, lacked concentration, paced back and forth, and at times yelled at the hospital staff, which does not help. I sat, I consoled, I was committed to the end goal. We were going to get her checked into the hospital and everything would be okay. They would fix her. And again, I was naive. Finally, at 3 a.m., a psychiatrist saw us. We explained that Laura was suicidal, that she had recently experienced some trauma, and that she was scared to be on her own. The psychiatrist didn't think that Laura really wanted help. He argued that she was merely drug-seeking. He was not going to admit her. I stood there in shock. I had sat in emergency for 16 hours, convincing Laura that this was the right decision and that she needed to trust it. I truly believed that the solution was getting to that psychiatrist. Eventually, I convinced him to admit her. I left feeling exhausted, scared, and alone. What had I just done? Did I do the right thing? Were they going to take care of her? Were they going to understand her? Were they going to see her? I barely recognized her anymore. I was in a world far outside my level of expertise. Not only did I have a very limited understanding of mental health, but also I had no idea how the system worked. Were there other options, and who could I ask? All great questions to be asking at 3 a.m. This particular hospital stay was about 3 months, though it's hard to remember, as now they all seem to bleed in and out of each other. Laura coasted for a few years after that. Then, as these things tend to happen in Laura's life, she experienced another trauma. Laura started to fall. So I invited her and her dog to move to Toronto around 3 years ago. She moved into my one-bedroom apartment that I shared with my partner, Kirk, and our young son. She slept in a makeshift bedroom in a hallway, and I tried to find her support in Toronto. The GPs that were suggested to us were not taking any new patients. I knew I'd mess that up. Or even putting anyone on the waiting lists. Counseling services were not returning our phone calls. No luck either with psychiatrists. Our living arrangement became emotionally and physically too cramped. Laura found herself a bachelor apartment just down the street. She continued to fall. She had no real support besides me, and I didn't know what the hell I was doing. Her apartment was a disaster, cigarette butts everywhere, dishes piled in the sink, and the curtains were constantly drawn. It is tragic to see someone you love living like this. It was July of 2016, and I was at work. I had not heard from Laura all day. I sensed that something was wrong. I called my sister Sarah and told her of my worry. She called an ambulance. I called Kirk at work. He arrived to find Laura in bed in the dark. The ambulance arrived, and we learned that she had taken over 80 pills. She was taken to St. Joe's. In those initial hours of not knowing if Laura would survive, I lost hope. I thought, maybe for Laura it would be better if she died. What life does she have to come back to? She has so much work to do. Maybe it's just not worth it. I thought these thoughts because I saw no way out of this cycle for her. She had struggled for over 20 years, and I empathized with Laura over how devastating this life was for her and how desperately tired she was. Also, I had no idea how much more I could do. For at least 10 years, I had been living in fear of Laura's death. I was tired of tuning into her moods and behaviors. I felt I couldn't carry that responsibility anymore. Laura made it through. There was an enormous relief that she made it, but then panic. What next? If history was any indicator, we were only going to be in this situation again. I turned to the emergency department psychiatrist looking for guidance. To be honest, I wasn't expecting much. I thought I would be given the same spiel as before, a table setting peppered with all the things that were wrong with Laura, and no recommendations on how to move forward. But that's not the direction the conversation took. It took me on a different road, and it has led me here. I was given the number for the family navigation program. I called, and an appointment was scheduled for that week. I felt hopeful again. When I talked to Ellie about Laura's story, she responded, "Wow, Laura must be in a lot of pain." Framing it this way helped us relate to her in a way that we weren't able to do before. Even if we couldn't fully understand mental illness, we could understand pain. For years, Laura had been avoiding that pain. She medicated the crap out of that pain with drugs, alcohol, and pharmaceuticals. After 10 days at St. Joe's, Laura was discharged. The discharge was premature, at least according to our plans. We were still trying to figure out where Laura would live. I was able to call Ellie and ask for guidance, and having her as a resource took the edge off my panic. This is when she asked me if I would like to participate in the Family Navigation Recovery Program, and I needed it for a few reasons. The first reason was that Kirk and I had decided that we were going to ask Laura to live with us again. To do this responsibly, we needed support. Besides the fact that we would be two sisters living together in our late 30s with different cleaning standards, Laura has adopted the falls under good enough motto, different temperature requirements, she would prefer to live in a refrigerator, and different sleeping patterns, she gets more sleep in one night than I get in an entire week. There was also the stress of knowing that she was in a fragile state. I needed a place where I could get advice from people who had lived through similar experiences. For that reason alone, I am so glad that I said yes to the Family Navigation Program. But there was a second reason to say yes. I was facing a very real possibility that Laura was not long for this world, and I didn't want any regrets. For me, this meant doing everything that I could. Part of that was honoring the Laura I knew, beyond the alcohol, beyond the mental health challenges, the funny, not as funny as me, intelligent, genuine sister that I knew. For this to happen, I felt I had to seize whatever opportunity came my way in terms of support, and the Family Navigation Program was just that opportunity to seize. The third reason was that it seemed hypocritical of me to ask Laura to dig deep and do the enormous amount of internal work that was required for her to recover without me showing some balance of effort. I wanted to demonstrate to Laura that mental health was bigger than me as well. The fourth reason was that in some way I was still naively looking for a solution where Laura would be motivated to form a life, be happy, or at least happy-ish, and get her ass out of bed. A solution for how to change her. I learned quite quickly that I wasn't there to learn how to change Laura. I was there to learn how to change myself. My role in her life was not to keep monitoring her and her behavior. My role was to practice hope and believe that recovery was possible. The rest was up to her. To be honest, the concept of recovery was foreign to me, and I was stunned that I needed to recover as well. The years of life and death moments with Laura had definitely taken their toll. Setbacks are expected in the process of recovery, and those moments are when it is most important to practice hope and not to catastrophize. Recovery is different for every person, and for me, it is fractured, it is fragile, and it is fluid. Recently, Laura and I were sitting around a table, and unprompted, she said, "I didn't even know recovery was possible until I moved in with you and Kirk. Now I truly do." It was the first time that I had heard Laura make a statement that was looking hopefully towards the future. Wow. That statement and belief is because of the Family Navigation Program.